It has been a very busy morning. We came up here and we had a very good meeting with some of the Northwest Arkansas educators, superintendents, higher education as well. And then we also had a very good meeting with our hospital directors and CEOs and the medical community, really discussing the unique situations here in Northwest Arkansas, bringing a statewide touch here to Northwest Arkansas. And I'm delighted to be joined today by some of our cabinet and healthcare officials from Little Rock. I'm joined by Secretary Johnny Key, Secretary of Education. We have Dr. Jones and Larry Larry Shackelford, CEO here of Washington Regional Medical Center, and then our Surgeon General, Dr. Greg Bledsoe. We have Dr. Cam Patterson of UAMS in Little Rock, and of course they're here in Northwest Arkansas. And then my Secretary of Health, Nate Smith, and we appreciate them coming up here and having this conversation today. And we have a lot of other healthcare providers in the audience that's joined us in conversation today. And I want to recognize the members of the General Assembly that are here that have been very supportive every step of the way. And I know some of them stayed away just so we wouldn't have as large a crowd, but thank you for being here. And we have our Congressman, Steve Womack, who has brought this federal perspective in our discussions today. Thank you for your continued support. I want to express appreciation to the healthcare workers, first of all. They're on the front line, they're working extra duty, they have home responsibilities as well. They have many challenges, and yet they are fulfilling their responsibilities, but going beyond that with a heart of compassion for everyone that they deal with, and I want to personally thank them. Since yesterday, where I had a briefing in Little Rock, we have had 4 new positive cases. So that goes from 16 to 20 in terms of the number of positive test cases here in the state of Arkansas. The 4 new cases include 2 additional ones in central Arkansas, and then we have 2 outside of that area for the first time in Cleburne County. And as Dr. Smith will address, this is tied to specific travel out of state. And I think that's an important reminder as our families are looking at where to go on spring break, what to do. In every instance of a case that we've had except for one in Arkansas, it was preceded by out-of-state travel and people coming back. And so you have to be mindful of where you're going, what you're doing, and ask the right questions as you plan these trips. And if there's an alternative, that should be considered for the spring break period. The testing has will be dramatically increasing in Arkansas during the next week. I want to applaud UAMS, Dr. Patterson, as well as the Department of Health in expanding testing capacity. And so as we receive those tests, they go to commercial labs. That information comes back to our Department of Health. We also will have our Department of Health doing daily testing. They expanded their capacity, and then UAMS is developing their testing capacity as well. And so what we will see in the coming 2 weeks, and even the next week, is that you will see a significant increase in the number of tests and the reporting of those tests that come back. And yes, when that happens, while a majority of those will be negative, we will see an increase of the number of positive cases across the state of Arkansas. And so our strategy is simply to be ahead of the curve, to mitigate while we don't have significant community spread in Arkansas. And if we start the mitigation procedures early, and that is limiting crowd size, we close schools for 2 weeks. These are mitigation strategies that allows us to go about life and business in Arkansas, but at the same time to mitigate against community spread or wider spread of the coronavirus. That is our objective. In light of that, we have received new CDC guidelines within the last 24 hours. And I previously indicated that I did not recommend community events or large-scale events in which there were 200 or more people indoors in a confined area for an event. CDC guidelines recommends that there be no indoor events greater than 50 people in which people would be in close proximity to each other. I would emphasize this is an event restriction, a recommendation, an event size. There will be instances in which you have commercial enterprises. It could be a factory, it could be a grocery store, or it could be a transportation system in which there will be more than 50 people as a whole in that commercial enterprise or system. That is not what we're talking about. We're talking about when events come together in closed space, those should be discouraged greater than 50. Our restaurants will continue to operate on their own choosing and based upon market demand. But I don't, normally our restaurants, I would discourage them to have more than 50 congregated in small areas, but our restaurants can be spaced out in a way that we can safely dine, we can safely exercise good health practices in that environment. Finally, I do want to come back to the travel, that I would discourage unnecessary out-of-state travel during this time of mitigation, because we're all going to be coming back to school. We're all going to be coming back and engaging in our activities again, and we want to mitigate against the potential of future spread and in the state of Arkansas. With that, I'd like to recognize Dr. Nate Smith for his comments and more specific details.
Thank you to the Governor for his support for efforts in fighting COVID-19. I want to thank our partners, specifically UAMS and our healthcare providers here in Northwest Arkansas, for your partnership in taking on this challenge. Since we last had our press briefing yesterday, we've had 6 new positive cases. 4 of them were tested in our public health lab. 2 of them were reported to us by one of the commercial labs. The majority of these cases were related to contact in the healthcare setting. And then, as the Governor's mentioned, 2 of them were related to out-of-state travel to a conference. And so 2 things I want to briefly mention, and how important it is that we protect our healthcare workers. And you've received some guidance about people who are sick calling ahead. We don't want to expose our healthcare workers unnecessarily. They're working very hard to try and evaluate and test individuals, and will continue to do that, in many cases putting their health on the line and at risk. And I want to thank all of our healthcare workers here for the wonderful job they're doing and their partnership. And the second is, as the Governor said, this is not a time to go travel to large conferences or large gatherings. We've got a lot of kids out of school, and they want to do something. This is a great time to go fishing with a friend as opposed to a big party. So keep those in mind. We can all do things to protect ourselves and to protect our neighbors and our family members. And I want to thank you again for your support.
Rick Patterson.
So thank you, Governor Hutchinson and your staff for bringing us all together. I just want to say very briefly that we've had excellent communication with the healthcare professionals here in Northwest Arkansas. I was on the phone last night with the CEOs of Mercy and with Washington Regional and Larry Shackelford. I really appreciate your leadership in this community and raising awareness about the challenges related to COVID-19. We're fortunate that we've not detected COVID-19 in Northwest Arkansas, but in our conversations with healthcare providers over the past few days and including today, we realize that there are opportunities for more communication, looking at normalizing protocols for screening, looking at best practices for who to test and who not to test, and those conversations are going to continue to make sure that we keep this community as healthy as possible. As the Governor mentioned, we are increasing the capacity for in-state COVID-19 detection. We will be receiving reagents at UAMS tomorrow, and we'll have an in-house test that will allow an 8 to 10 hour turnaround time for COVID-19 testing. By this weekend, we'll be able to do about 250 assays a day with this, and we're looking for other means to increase our capacity. And finally, I would like to also say that for those of you who are accessing healthcare assets like hospitals and clinics, I know that there are restrictions in terms of visitation, both in clinics and in the hospitals now. Whether your loved one or family member is at risk for COVID-19 or not, this is a big inconvenience. It's an inconvenience for all of us. It's not what we want to have happen, but we ask the community to understand that this is for everyone's protection, including the healthcare professionals who we're finding are at exceptionally high risk of transmissibility with this particular virus.
Surgeon General.
Well, I want to thank everyone for coming out today and thank the governor for his leadership and Dr. Patterson and Dr. Smith for their leadership. And I would just like to echo what they've already said. And that's, first of all, thank you to the folks around the state who are healthcare professionals who are truly in the line of fire and are sitting there watching these statistics, and they're seeing this and they're growing concerned and their families are growing concerned. But I just want to say to those healthcare professionals that we understand where you're coming from. I'm an emergency physician. In addition to being the Surgeon General for the state, I'm still working clinically. I worked 4 shifts last week, matter of fact. And so I'm very aware of the concern and the stress that this is putting on families and colleagues. But first of all, we support you. We're grateful for you. We're very thankful that you are where you are. And if you need things, reach out to us, to the health department and others. We're going to be here for you. And then also, for those who are patients or are concerned about getting screened, please be conscientious to the folks in the emergency departments in some of these clinics. Be discerning in whether or not you request a test. If you're sick, certainly that's why we're here and we want to take care of you. But just be mindful that there is an overabundance of people who are seeking medical attention at this point, and we want to be understanding of our healthcare workers and the other patients. So thank you to the healthcare providers. Thank you to those who are making the sacrifices necessary to serve our communities. We really appreciate you.
And I wanted to express thanks to Larry Shackelford, our host here today of Washington Regional Medical Center. And Larry, not only have you been a good host, but you and your medical community here have been real leaders in terms of bringing testing closer and in a safe environment by having the standalone clinics. I just got off the conference call with the president and the vice president. Both were on the line. They were both urging these freestanding, standalone, off-site testing capacity, and it was nice to be able to know that you've already done this. We've already got this in Northwest Arkansas, which is safer for our healthcare workers as well as for the patients and giving them increased access. For Larry, why don't you come and make your comments?
Okay, thank you. Thank you, Governor. Thank you all for being here in Northwest Arkansas. I think what you all have observed is what's been happening every day to my colleagues from Mercy, from Northwest. We're trying to work together every day to be sure that patients are taken care of. This is the business that we're in. We have dealt with other health issues. We do have a plan, and we're enacting that plan. I would guess one of the important things that happened today was to have healthcare leaders and education leaders in the same room, talking practically about what tools do we need, what things do we have to have in order to provide the care that we need to our patients. But continuing on the theme, thank you for those healthcare workers that are out there every day. And our major point is those healthcare providers need to feel safe. They need to feel secure about their families. They need to know that their children are being taken care of so they can get about doing that job. So we are talking about how can we have child care that's available for our fire department, police, healthcare workers. What are things that we can practically do, again, so that those workers can know that their family is taken care of. So again, thank you.
Thank you, Larry. And let me turn to education. We had our education leaders here, and while many of them are here, I did want to have Dr. Debbie Jones to make a comment about what they are doing as they have 2 weeks of online distance education. Dr. Jones.
Thank you, Governor. I know that our parents and our students appreciate the ongoing and transparent communication to keep up with the information. The health and safety of students throughout the state is the #1 concern of all educators. And as our students begin their at-home learning this week, they may have a little time for fishing, but learning is still occurring throughout the state. school districts are also making extra efforts to continue to feed students. And so I'd suggest that you visit with your school district to see how students within your district can continue to be served. And when we're called upon to return to school after spring break in 2 weeks, then our schools will take the extra precautions necessary to ensure that our students and our staff maintain their health. Thank you.
Thank you, and our Secretary of Education is here, and we've talked about what the students need to be doing in terms of safety, but our educators in terms of preparing the schools for the return of class after spring break. Secretary Keith.
So just like we've expressed our thanks to the health workers around the area and across the state, I want to express my thanks to the teachers, the educators, the support staff, because this was a quick turnaround time for many of them from the time that we announced the decision on closing schools this week many of them had already prepared, which I think just goes to show that our educators are looking ahead, looking to see what needs to happen to make sure that we're doing the right thing that's in the best interest of our students. And now as we kind of take a shift this week to see what the current week of AMI days look like, and then we have spring break, and then preparing, getting ready, understanding what it is that needs to happen to come back after spring break, barring any changes in circumstances. And we'll be working with our superintendents and school officials to make sure that we have those steps to make sure the safety is at the highest priority. Not just safety for our students, but we also recognize there are teachers and support staff that fall into the category of higher risk. And we want to make sure that we take precautions and understand their situation as well. But we look forward to returning to some normalcy, because that's what students need. They need routine. So parents would encourage you that during this time of at-home instruction, create routines, create normalcy as much as possible, and then we'll do our best to try to get back to a normal routine across the state in a couple of weeks.
Johnny. With that, we'll take any questions. Yes.
Governor, working with the educators, during this 2-week period, we hear from the CDC, 8 weeks is the window they're looking at to see, okay, that's the time they need to really get a better handle on what they're looking at. They keep talking 8 weeks. We're given 2 weeks here. So what signs are you looking for specifically to go ahead and start class again? And what might not you see, and could that be extended to the time that the students are at home?
Well, on the CDC guidelines, they indicate that there's not a need, and they do not encourage simply closing of all the schools. I talked to the CDC director just the other day, and he affirmed to me that he cautioned against the reaction of just closing the schools for the rest of the year. That's not what CDC is recommending. CDC recommends that if you have a positive case in a school, that it might be closed for 2 or 3 days to have a deep cleansing of the school and to have, of course, the child to be having the proper care, and then classes resume. Now, sure, if you close schools all this year and all next year, that's, could have some beneficial impact, but we don't want to do that. It's more important to get a handle on it during this 2-week period, and then go back to normal class schedule after that and manage it. And so that's our expectation. Now, CDC guidelines could change. There could be a different approach. We'll measure that, but the emphasis is that we need to prepare to go back to class and resume normal class activity after the spring break. And that's consistent with our CDC guidance.
Governor,
Yes.
maybe I misheard, but I think you said 4 new cases, but we, Dr. Smith, said 6.
Well, we're just looking at different time frames, I believe. There's 20 cases total. Yesterday, I reported 16, so I believe there's 4 new ones. I think that they overlap if you look earlier in the day yesterday.
Okay. So
Dr.
20
Smith
is the number?
Well, actually,
All right.
22, we had 2 more reported to us from a commercial lab this morning, so I'm
Okay.
sorry for throwing you off, Governor.
All right, so we have 22.
We do.
Actually, that's actually what my notes say here. I just read it wrong. So 22, thank you.
Is the state advising childcare facilities like daycares what to do at this time?
Those are independent private provider decisions on most daycares. And so we hope that they will be able to stay open to provide child care for those parents that need to go to work. Obviously, they should take the appropriate precautions. They need to look at how many they're caring for, but our decision in terms of closing schools for 2 weeks, the physical schools, is reference to K through 12, and that does include our ABC program, which is part of the public school environment, but other daycares certainly can stay open, and we certainly hope that they will.
When do you think we're going to reach the height of this pandemic in Arkansas?
I was asked today that it's important for everybody to have an understanding of where we're going in the future. I can't predict specifically the time frame for the height of this, but I know that the end will come sooner if we mitigate and address these problems aggressively now. And that's what we're doing, so we'll bring a quicker conclusion to it, and that when we get to the height, it will not be as high. And I want to invite our Dr. Smith, if you want to comment further on just sort of what's ahead over the next month.
I agree with everything the governor said about that. We're really trying to slow the spread of COVID-19 in our state as well as in our nation in a way that may actually make the whole response more prolonged but more manageable for us. And we're going to continue to do aggressive measures now to try and limit the spread when we can, and then manage those cases as we go along, as we have increased number of individuals in our healthcare system, focus on managing that, and then helping communities to recover and to bounce back stronger.
Any update on those drive-through clinics we're hearing about from Target and Walmart?
They continue to work toward those. It is important to note that the president asked Walmart to help develop that along with Target and others, but the target is, I believe, for 6 major hotspot areas across the country. And so the initial rollout of that, when it is available, should not be expected in Arkansas. And so that's why it is so important what Eric Penalto has done at Mercy Health, and what we have done here at Washington Regional and others for the standalone outside clinics that they can come by and get tested in. And so that serves the same purpose in a different fashion, but the other solution in the larger stores is something that's down the road.
The health department,
Yes, ma'am.
are you considering limiting this visitation to prisons or jails right now?
Currently, the guidelines for prisons is limited. Their visitors are screened when they come in. Some of them have been turned away because they did not answer the questionnaire appropriately, or they've been out of state travel and other concerns. We continue to review that, but we're specifically screening the visitors and having a more limited visitation, and if that needs to be adjusted further, we will. Yes?
The health
I'm sorry.
department has 14 people under investigation and 258 being monitored. Are any of those in Northwest Arkansas or the River Valley?
Dr. Smith?
We generally don't disclose specific locations for individuals, but we put on our website where we've done the testing, indicated by where we've had negative tests, and we've also let you know when we have positives in a particular area or county.
Yes, ma'am.
For parents that have to stay home due to schools being out right now, they might be losing out on some income. Is there anything for them as far as like where that income is coming from?
Well, first of all, the President and the congressional legislation does provide for family medical leave that will be covered. And so I know Congress has worked hard on that, and so there will be some assistance out of that federal legislation as the Senate acts on it. And secondly, we know that there will be people that will be laid off because a business might close or other circumstances. And so I've directed our Department of Commerce to look at where we are and how we can facilitate unemployment benefits going in a quicker fashion. So we recognize some hardships out there, and our economic team is working on any ways that we can provide relief, and I know the federal government is doing the same.
Governor, two related questions. To my knowledge, this is the first time you've held one of these briefings outside of Central Arkansas. Why here, why now, especially if we don't have any cases?
Well, it's always good to get out of Little Rock. And for those that are watching online, I love Little Rock. And the mayor's doing a very good job there. We talk regularly. But Northwest Arkansas is one of the population centers of the state. We are regularly up here, but specifically in reference to the coronavirus, it's very important to be here to listen to the medical community, the education community. So it's not just about me doing a briefing up here, but it's about listening, and and to have a good understanding of the challenges that are faced here. That's the reason we're here, and I'm very grateful for the team that came here to listen as well. And we hope that we'll not only be here, but also there's other parts of the state that we hope that we can have this same type of conversation. In terms of the daily briefings, you know, I do think it's important that we are transparent, that we give every bit of information we can, as people have to make decisions for their families. And so we've been doing this consistently. I don't know how long it will continue, but it has been important, and we'll continue to do it as needed. Yes?
Yeah, Governor, can you talk about the issue of panic buying, you know, and the effect that it may or does have on the process of that you are all engaged in, that is healing and coming up with programs and procedures that don't take us backwards, but take us forward?
Well, everybody needs to understand that grocery stores will stay open. They're open for business, and they will continue to be open for as long as we're going through this. And so there's not any need for panic buying. And sure, everybody wants to have a few days extra supply because it might be difficult to get out at some point. But we don't need to go in there and hoard. We don't need to go in there and do buying for a month, because the stores will be open and the supply chain continues to work. That's why people are working today. And so everyone needs to think about their neighbor and to make sure that we don't do any of this panic buying. And I applaud the Attorney General, Leslie Rutledge. She made it clear yesterday that the price gouging is illegal. It carries stiff fines and penalties. And it is a problem. Dr. Patterson might want to make reference to it, but we've seen steep price increases at the hospital level for very important protective equipment that they need. And this is not reflecting market, it's reflecting, in many instances, simply taking advantage of this shortage. Do you want to say anything, Dr. Patterson?
Yeah, I would just say this is a very serious issue that we're facing. For example, masks that normally cost 80 cents are now being sold for $18 each. So this is a burden for all healthcare professionals. It's going to make it more difficult for us to provide the care that we need to provide. And we salute and thank Attorney General Rutledge for her leadership in ensuring that the people of the state of Arkansas are not punished by price gouging.
Yes, ma'am.
As far as government offices, are those going to stay open for now, or are they going to move to more of a remote situation?
They stay open. Now, some of the individual workers, depending upon their circumstances and the access of working remotely, they may work remotely, but government functions will continue. We have to get SNAP benefits out. We have to deal with Medicaid. We have to be responsive from a health standpoint and on down the line. So state government business will continue. The offices will be open, and in some instances, workers will work remotely. Okay, is there one more question? Doug, I thought I saw you,
Yeah,
your
I
inquisitive mind.
realize this is mainly a public health story, but there's all sorts of business issues here. I mean, the unemployment insurance fund was finally built up after strenuous legislative effort. Now it's about to take a big hit. Businesses are going to wind up paying sales taxes this month while their revenues are cratered, while you got, and I'm sure I'll put it this way, that rainy day fund apparently is going to get some withdrawals sometime in the future. Could you talk at all about the business and economic and state revenue impact of all that?
Well, we do know there will be an economic adverse impact as a result of the coronavirus. We see that nationally, and we see that here in Arkansas. Now, we're just at the very early stages of that, but I know that we're going to have workers that are laid off because the business has slowed down, and that's why while we have to be smart, we also have to smart in terms of our health. We do need to go about our business. I mean, we have to have the supply chain working. That generates the economy. I mean, construction work continues. We're continuing to build. We continue to serve the public, our banking institutions. So the work continues to go on, and we don't want to slow that down. What we see, while we've had a spike in terms of grocery shopping lately, over the long term, it's our restaurants that are going to suffer. It's going to be the entertainment venues. Tourism is our #2 industry in Arkansas. If people don't go out of state and they go to our state parks, we might not suffer as much, but logically, there's going to be more people staying home and not out spending. So there are some economic consequences. We're prepared to deal with that. The biggest concern I have are those small businesses that are going to be struggling, and they're going to have to lay off some workers, and we want to smooth that as much as we can. And I know the Congress and the federal government, the President, is looking at ways that we can ease that burden, particularly on some targeted industry. But that's why we have a rainy day fund, and that's why we first address the public health issues so there's not long-term consequences, and then we'll address some of the short-term pain that we're having to undergo now.
In your discussion with the President, or in a conference call or whatever it was with the Vice President and the President, was there any talk, even speculative, about like federalizing the National Guard or any other such thing?
No.
Okay.
No, the National Guard we have brought as a state resource, and they're available for logistics, for call center support. They have some expertise that's helpful to us. So I've taken that action as governor, but I'm not aware of any other federal action that's necessary or being considered. One final question right here.
So we actually had a caller call in and say that there are long lines waiting to get tested. Is that recommended to wait outside in these long lines to get tested?
I'm going to turn it over to my healthcare team.
Are you going to address them?
Larry, why don't you address it first and you'll back up?
Sure. Yes, so we are in process trying to do everything that we can to be able to test those that need to be tested, to do it timely. Again, if there are other alternatives, if you're sick, stay home. If there are digital resources, please do that. If you want to talk to a nurse, there's hotlines that we and other healthcare providers across Northwest Arkansas have. So please don't come to be physically tested until you have done one of those other things. Other than that, we're just trying to use the best resources we have, use the test kits that we have to be able to get those in and do so as timely as possible.
Yeah, I would just agree with what Larry said. The first thing that we're recommending is if you think you need to have a test, reach out to your primary care doctor and have a conversation with them via the phone. Don't run to the clinics, don't run to the emergency departments. There are 3 million people in the state of Arkansas. If everyone decides they need a coronavirus test today, there's not a lab in the country that can keep up with that demand. So we're trying to prioritize, and we're committed to getting testing done on any patient that needs the testing. But we just ask the community to please be discerning in your request for the tests and go through your primary care doctor as a starting point.
With that, thank you for being here today, for helping to cover this story that's critical to all Arkansans. Thank you very much. Larry, I owe you.
Thank you.